Yes, so we are live. Greetings and a very warm welcome to everyone in attendance. As the Clarinet moderator assigned to this session, my name is Kashish, and I extend my cordial greetings to all of the delegates from across the country. We sincerely appreciate all of the doctors who have taken the time to attend with us today. So, allow me to briefly introduce our platform, Clarinet, which is one of the largest live digital continuing medical education platforms offering a global space for healthcare professionals to collaborate, create, and engage with medical content. And now I would like to take a moment to introduce our speaker doctor for today's global session, Dr. Rashan M. Taraben, sir. Dr. Taraben is an American board certified neurologist and neurosurgeon and the founder, CEO, and president of Cell Therapy International. Illinois, USA, with extensive leadership experience, including roles as medical director, chief of staff, and founder of multiple medical institutions. He has been recognized with numerous prestigious awards, such as the Top Doctor in America and the Physician Recognition Award from the American Medical Association, and also is an active member of several leading international medical societies. So, sir, we welcome you wholeheartedly to our platform today. And once again, I welcome each one of you at today's lecture on the topic ADHD, a gift, not a disorder. So, now without any further delay, I would like to hand over this session to you. Dr. Taraban, you may proceed with your talk, and over to you. Thank you so much.
Thank you, Ms. Kashish. I appreciate that kind introduction. Hello, everyone from America. It's nighttime, your time, but it is still daytime. You could see in the back here, we still have the sunshine. It's 9:03 a.m. my time. I'm on the Gulf Coast, southernmost part of the United States. For those who really, I'm not going to waste time telling you about my resume. It is at the bottom of the screen here, which you could find me on LinkedIn. And here's my email. Any question of whatsoever, even a critique, please don't hesitate to send me and share it with me. We're going to talk about ADHD. I have very compassionate feeling about ADHD because of the misnomer as a disease or a syndrome, but it is not, as you will see. And let me tell you why. Attention span across the life, our life throughout from birth to death, the attention span varies at every single stage. While in 0 to 2 years, attention mostly is reactive. So the child really learn things effortlessly. Without any effort, the child learns. Why? Because he's a sponge and everything falls on his vision view, or he hears any sensation of his five are being recorded 24/7, and the learning of the child is, as I said, it is really effortless. 3 to 6 years old has a sustained attention, something that we wish we could have a fraction of at this age. So he has less impulses from 3 to 6. 3 to 6 is really the most learning period of the child, where he really makes no effort to learn. He's learning without even doing anything. And that goes down as we kind of, grow older. And when we get to the young adult, we become a complex attention, multitasking, and goal-directed focus, where we bundle that with different things at the same time. However, when we become like at advanced age, we started to kind of, because of the so much enormous amount of information, have to start to have selective divided attention. So for somebody who's 60 years old in a meeting, he tries to focus on the whole crowd that he's around on one or two people, because really he cannot face the whole thing. So the attention span starts to shrink as we all grow older. By age 6 and education, we're talking about adults here, adults, usually their attention span is about 12 to 15 minutes. Middle age, 12. It shrinks down to 8 to 10 minutes maximum. We're talking about maximal here. It doesn't, that we're talking about the top. The most you could stay attentive at age 6 years old is 8 minutes. As far as sex, women are slightly higher sustained when it comes to attention, while men have more impulses. And that also varies with education. Higher education, usually highly educated people have stronger, focused attention than none. Think about the attention is pretty much the valve that allows information to go into your memory, and that is really the hallmark of learning. If the attention is closed, you're not going to learn anything. If, as I speak right now, you're thinking of something else, you cannot remember a word of what I'm saying. So keeping that port open, which is the attention, is the way to learn. And without it, learning and making memories is impossible, literally impossible. So without attention, there's no registration. And if there's no registration, there is no retention or recall. This is as simple as that. And I'm sure that this is kind of simple thing, for many people to know it. Whenever I talk about ADHD in the United States and in other platforms across the world, I have done is I always talk about autism. Why? We have ADHD here. And by the way, ADHD is really the syndrome. Some people say, oh, there's ADD and there's ADHD. No, it is ADHD. Sometimes the activity is masked and sometimes it's not, but the whole thing is, the main syndrome is ADHD, and ADD is a subtype of ADHD, unlike what many people think. So we have autism here and we have attention. And if you look here at that slide, this is the amount of attention that God gave us. It is God gave us. It's not, we don't have it actually. So in autism, we are way hyper focused to a degree that we don't see anything but one thing or two at the most. ADHD have very little of that attention. I put here something normal, meaning that, we are easily distractible, but we could pay attention if we want to. I wouldn't call it normal, but I would call it the prevalent of people, of the prevalence, the vast majority of people, they fall in that range right here, where they are between ADHD and autism, meaning that they are distractible, but they could focus if they want to. The paradox of attention is really the hallmark of how to learn and grow. A human struggles between two poles. Life unfolds when knowing when to let go and when to hold on. And that is really the art of living. These people are not creating for no reason. These people are created for a reason, as you will see why. Now, the spectrum of attention, think about all the time the following, that, we are at the edge of a huge black hole, and that black hole is called brain. And throughout that black hole, 30,000 to 70,000 thoughts or ideas crosses the brain every single day, meaning that somewhere between 1,800 to 3,000 thoughts per hour. So meaning that at the end of this lecture, each one of you will have that amount of thoughts crossed to your brain, but you just are not paying attention to it. And I hope not, because otherwise you will be missing what I'm saying right now. So during the lecture, some people might receive a text, from somebody, and that's a distraction. So it's like, throwing a ball on the curve, and person is during that period of time when he had to respond 5-7 minutes, and maybe after that the text is over and the call is over and he responded to call, and he's still thinking about, like, a call from wife or from loved one, and another 2-3 minutes thinking about it. That time that attention was absent to this lecture is gone. You'll never recover it till you play back the recording and see, what was said during that time. So ADHD is inattention, impulsivity, distractibility, while autism is hyperfocus, routines, and precision. And again, as I told you earlier, we cannot understand ADHD without autism. This is really the two things that they are at the end of the spectrum of attention. And understanding both of them at the same time makes us really better physicians, better clinicians, and better people to understand these people, because these people really are not diseased. They are not. In the United States, I will share this information with you guys for adults and children. The prevalence by sex and age for diagnosed ADHD, there is more prevalence between 5 to 17 years among boys than girls. So almost double, 14 and a half as opposed to 8% in girls. How about the ages? The ages 5 to 7 is less than the 12 to 17. So more people between 12 to 17 are being diagnosed. Is it really true that it is really more prevalent, or maybe just because these people, they get diagnosed faster because they are in the age in the school when they start the teachers to learn to see there's some delay here. So by gender, those people who are taking medications currently in the United States, I'm talking about the United States, and probably that's an example of the whole world, I would assume. Boys and girls are equally medicated in the United States of America. And by age, the vast majority of people medicated are 6 to 11 years old, followed by 12 to 17 years old, while in the younger or later, they are a lot less. Medication meaning taking pills. Now, in adults, a different story. By age, 25 to 49, they constitute the vast majority of diagnosed ADHD, 25 to 49, while really substantially drops down diagnosis-wise for new cases after age 50. While by gender, they are close, but still it's more prevalent in male adults ADHD than the females. And we're talking about here NCHS, which is the National Center for Health Statistics. And that is really fairly recent, study that was in 2023. Is ADHD all the same? Of course not. We have main three types of ADHD according to the Bible, which is DSM-5 that we have in the United States and probably the world, I would say. The type 1 is predominantly inattentive presentation, which really now they used to call it ADD, which is really still ADHD, but yet the hyperactivity is not present. Being distractible, disorganized, forgetful, and cannot sustain focus. Predominantly hyperactive, that's when the activity, fidgeting, restlessness, excessive talk, interrupting, acting without thinking, this is the typical ADHD that we see probably most of the time. And then we have the combined, meaning a little bit of this, a little bit of that. But however, throughout the course of life, whoever has some type, he will crosses over to this, or she will crosses over to this, to the other type. They don't usually keep the same type. Here's a DSM. I'm sure that you guys could look it up, from your sources, and the ADHD and ASD, which is with autism syndrome. See, the core feature is inattention. Here's social communication deficits. I wouldn't really go over that because you could look it up, yourself. And as I said, ADHD and ASD, which is autism, are at the end of a long spectrum of the attention. ADHD has very little of the attention. ASD has too much of it to a degree that he doesn't see anything else. Some of the positive things that I can tell you that I saw myself in many people with the ADHD is their resilience. The ADHD is fearless. He's brave. And he really drops, falls, stands right back without even thinking. Just dust off, and just keep going. They don't fear anything. And sometimes it's really dangerous. And as you will see in a minute, always ready to start fresh. What keeps us people, adults here, from trying things is that, the fear from bad experiences. Let's say that somebody went through bad divorce, he become very reluctant, to get into another relationship and such, not ADHD. ADHD could have 1,000 failure and he will start fresh as if he's never failed before. And that's really a gift in by itself, in my opinion. Uh, so it is not really a deficit. I mean, I would disagree with many people who would call that a deficit. It is just an attention difference, and it is basically misunderstood. In America, really, what bothers me the most is that when teacher, brings sometimes, to my clinic, some kids, and I say, I will ask her, what's the problem? And I say, oh, nothing. He's just crazy. What crazy are you talking about? This is not a diagnosis. It's just simply because people are different and because you're not the same as the person that you're looking at. It doesn't make you normal, nor neither him, because the creator knows what he's doing. He created these people for a reason, as you will see in a minute. Uh, reminding you that really a lot and many of brilliant inventors and highly creative people, figures, brought valuable ideas to life were ADHD. Actually, they were in severe case of ADHD. Uh, Examples often are cited in history is Thomas Edison, who did 1,069 times trying to light a bulb, and he fails in every single time, till finally the bulb lit, and we have now the light because of Thomas Edison. The same thing for Scott Kelly, who is a well-known ADHD, but he's one of the most brilliant, astronauts in NASA in the United States. As far as autism, the same thing, really. We have so many innovators, so many. We'll take an example. Elon Musk. Elon Musk has Asperger's disease, which is the probably most severe cases of autism. And what he's done to humanity is enormous. Uh, Harnessing the gift is really your job as a clinician. It is not destroying it. It is not hammering it with drugs and make that person similar to the whole class. God made him different because of a reason, because he has a job to do. And we'll get to that in a second. So exercise boosts focus and mood. Nutrition also supports attention. The ADHD, if we could just pay attention to his sleeping pattern, the diet, skills training channels, make him interested, or her. With the structure, ADHD becomes an enormously powerful tool to learn even faster than anybody else. It is actually what I would call it. ADHD is a true blessing to the world. Suppressing ADHD risks losing the sparks of discovery, which is really carried out by these brilliant people. ADHD basically brings humanity relentless curiosity and energy. The energy that they have is enormous, unbelievable. It fuels breakthroughs and moves the world forward. On the other hand, this is now the setbacks of the ADHD, and as clinicians, we have to work on that part. As I will just show you in a minute. ADHD are at increased risk for substance use disorder because they are willing to try everything and anything. And that sometimes is not really good when it comes to drugs. And the moment he or she does it and get discovered, then you will think about all of the anxiety and the academic underachievement and the hammering by the family and such. So keeping an eye for what the ADHD person is trying is the key here. Alcohol, drugs is sky high at ADHD if not monitored. ADHD also, there's comorbidity between it and between OCD. Actually, a good part of the ADHD, they transform into OCD in some individuals. And as they mature, they become like a prototype of OCD. Treatment should be focused as clinicians on reducing impairment and the risk to harness the strength, but not the weakness. And again, trying everything. The love of venture is embraced, but not always though. And as clinician and parents too, we have to pay attention to that part. It can be gift to the world, of course, as I have mentioned. ADHD carries strength, energy, curiosity, and courage. ADHD individual is not held back by bad experiences. He is willing to do even the same thing over and over and over again relentlessly without hesitation. So we have to embrace the gift, but not the label. The label is really just a label, and sometimes it's actually mislabeling, and that is really the bad thing. Resilience is really the name of ADHD. That's what I would probably describe ADHD population with. Resilience. They are resilient. They are fearless. Most people are held back by failure, and they don't, because we are all withheld by fear from the past or the future. ADHD is ready to start fresh every minute, every day. And again, as a reminder, as I just mentioned to you earlier, a lot and many of innovators are ADHD. The diagnosis, if you go to the textbooks, people, I mean, you will see, not text actually, if you go online, actually, you will see hundreds, maybe at least more than dozens of people who created a scale, and they will tell you this is the, a scale, and this is like scores, and if somebody has more than 50 points, he has the diagnosis. I will tell you that this is all has no credibility whatsoever, and it is just a personal opinion of people that it's not supported by any data. For both children and adults, the most reliable test is not a single lab or computer test. It is a structured DSM-ICD-9 or 10 rather, based clinical diagnostic evaluation with collateral informants or information and validated rating scales. The treatment, really, that's what we are after as clinicians all the time, is the best results is when we combine the skills, behavior supports, but only when indicated, we start medication. Only when indicated. When everything fails, medication is the last resort. It's not the first resort, as the case. Even in the United States, we have a lot of physicians who push, drugs. The moment that parent bring a child and say, oh, he's crazy, he's ADHD. Well, oh, it looks like ADHD. So in order to please the mom and drug that person to become like humble and silent. I mean, the way that I've seen ADHD children transformed on drugs, it makes your heart break in crying because of, the suppression of that, creativity becomes a person who's sitting on the desk, just careless, doesn't care, doesn't, it's not that there's the spark of life is gone with drugs. So don't do drugs, please, unless you have, tried everything, especially CBT. CBT works. It worked in every single time in my experience, and I don't see it. The only time that does work when somebody doesn't do it the right way. Stimulants, again, it is the last resort, and pretty much it is the the stimulants all are the same, unlike what people might tell you. And non-stimulants is another option, which really you could if you are concerned about, the side effects of the stimulants. But again, all of these drugs are a second to skill, behavioral support, school and work accommodations. These, in my opinion, worked always, and the only time it didn't work is when it's not really applied properly. Age-based approach is really the rule of the theme here. And 4 to 6 years start with training the parents. The parents really should know that this is, you are sitting on a gold mine. This is a child that is your retirement account. This child could really come up with an invention that could really put you to retirement at early age. This is not a liability on you. But if you don't harness the greatness of that child, you're going to destroy your chances and destroy that child too. When it comes to school age and adolescence, we have a lot of FDA approved medications. Again, it is a second line to behavioral therapy. Again, behavioral interventions matters the most. Both parents and teachers should be involved in that. And as a clinician, you need to be patient with the parent. The parent sometimes is overwhelmed by harshness of life, lack of resources. Sometimes she's a divorced single mom, and she really wants a trouble-free child where she could go to sleep without worrying about what he's doing or what he's venturing in the living room, maybe, and that is really a concern. And if she doesn't like you, she's going to go to another doctor who gives her the drugs. But still, uh, we have to do the right thing, definitely. Uh, Treat the comorbidity. We have, if the child sometimes with the ADHD has a sleep, anxiety, depression, all of these should be treated, which are a comorbidity. Once we clear that out of the way, the ADHD will get better enormously. Monitoring and safety part of the treatment, track symptoms response. Do not forget that the stimulants have, a good bit of side effects. As a matter of fact, the Canadians, they banned Adderall in, I believe in 90s, sometime like that, because, they had 4 deaths of children. Of course, they had congenital heart disease, but because of these 4 deaths that happened back then, they banned Adderall. However, ironically, they're okay with Ritalin, they're okay with Concerta and other neurostimulants, which are no different than really Adderall, but they banned it in Canada because of the side effects. Make sure that you check on the heart before you even start it, not having some congenital disease. The education of patients, clinicians, and general public is an important aspect here, where educating people that ADHD is just a different style of attention. It is not a lack of attention or absence of attention. It's not. The theme here is the optimistic drive, bold self-belief, and resilience, courage under pressure. ADHD does not submit to pressure, does not submit to, doesn't get discouraged. He gets discouraged only from his parents thinking that he's crazy. That's it. But the ADHD individual, a girl or a boy, they do not get discouraged by failures. High energy. I wish I could I wish I could have a fraction of that energy actually at this age. Curiosity and playfulness. They are always curious about everything. Confidence and uncertainty. Comfortable improving and adapting to real time. Persistence throughout setbacks. Failure doesn't do anything to them. It's just, it's just unbelievably stunning to see how they dust off after falling, not even caring about who is laughing. And they keep going and they try again and try again and keep trying till they, whatever is in their mind, go through. Fearless. As a matter of fact, all of the USAF Air Forces children, pilots, they are tested that they should have at least a trait of ADHD, being fearless. Whenever you get focused on a mission, he is nose diving on a tank, knowing that, if he doesn't hit it before he hits the ground, he knows that if he hits the ground, he's dead, but he doesn't care. His mission is to hit that tank that he's diving to hit, and that's it. And these people are filtered very carefully in the US Air Force, and that's why the United States have the best pilots of the whole world. Leadership sparks motivates others. Sometimes really they motivate me, even, when I see an ADHD, I say, wow, I wish I could have a fraction of his energy. So it's not lack of ability, it's different type of attention, energy, and creativity is the theme of ADHD always. And if we have an accurate diagnosis with the right support, we could harness the goodness of that condition and try to avoid the setbacks of most importantly, really, is substance abuse. Your job as a clinician is to fix the person. It's to build the environment and skills that let the gift do its work. It's not to suppress it. It's not to take it away. So we have attention difference versus attention deficient. We talked about it, but I would like to stress on the fact that the ADHD is an attention variability. It's not absence or deficit, and it is attention in ADHD is often intense but inconsistent. So it really kind of waxes and wanes. It's not always that he doesn't pay attention. No, you're wrong. ADHD is highly responsive to interest and urgency. If you get his attention, if you get his interest and talk about something that interests him, he is too focused, more focused than you think. So in a way that when we see, an individual out of focus, especially a child, I want to blame myself because I didn't manage to get their interest, and I let them drift away from my talk. So it is a failure on my part, as opposed to blaming him that, oh, you're not paying attention. Well, how would you pay attention? Because if you think about your speech, is such a boring thing, um, and I hope my speech was not actually, but difficult to summon vulnerability, but powerful once engaged. It's hard to get him engaged, but when he is engaged, he will never let go. He really is way too focused, or she rather. ADHD is a gift to the world. It carries strength, energy, curiosity, and courage, and we must harness the greatness and embrace the gift, not the label, is the name of the game here. Ladies and gentlemen, this is really was a brief. This is a whole book. I talked about it. In a whole book, and it is on Amazon. It is totally free for those who have Kindle, Amazon Kindle, and I would really urge each one of you guys to take a look at it, because really I went in depth of ADHD is a gift and not disorder, defined by that probably most clinicians that I know of, and I would love to hear your opinion about it. And the lower left corner, you will see the hyperlink that takes you straight to the book on Amazon, which I think that Amazon has has a link in India, as far as I know. With that, I would close. I would love to hear what you guys think about what I talked about, and I appreciate your attention. Thank you very much. Miss Kashish, are you there?
Yes, sir. So, are you done with your presentation, sir?
Yes, madam.
Yeah. So, sir, allow me a moment to put the question slides on. And
Sure.
thank you so much for your talk, sir.
Absolutely.
And with your permission, I'm just stopping your screen sharing, sir.
I'm sorry, I didn't hear you. What did you say?
I'm just putting the question slide on.
Oh, okay, okay. All right.
So is it visible, sir?
It is visible.
You may
So,
proceed.
yes, ma'am. Thank you. Thank you. The first, doctor, how does hyperfocus attributes to high performance in specialized domain? Very good question. Hyperfocus is somebody which is the autistic. The autistic is really kind of have a tunnel vision. Tunnel vision, he sees only one thing and he doesn't see anything. If you throw a bomb next to him, he wouldn't even hear it. He's too focused on one thing only. And when he's focused on something, he will keep thinking about it over and over and over and over again. Think about it, that one of the patients that I've seen myself, he's autistic. And he really popped in his head that he wants to build castle of sand on the beach. He did that from Pensacola, sorry, from Mobile, Alabama to Pensacola, like good bit. He's building one after another after another. That's, of course, it's purposeless. But, you know, on the other hand, somebody like Elon Musk is focused on how to build cars, and he doesn't see anything but that. He doesn't think of anything but that. See, these people, they have hard time to have a family. They have hard time to have a wife. They have hard time to have friends because, people mislabel them. And even Elon Musk was mislabeled. Well, mislabeled as being crazy, being, weirdo, being whatever. But hyper focus, it depends on what you're focusing on, and only God knows what you're focusing on. Like that child that, as I told you about, he was like 8 or 9 years old, and he built castles for like thousands of meters, one after another, of sand. He chose that he wants to be focused on building castles of sand, and he kept doing, and if he let go, he probably will build castles all the way in the United States, if he wants, if they let go, but they didn't let him go. But uh, not always hyper focus contributes to high performance. It depends on what you're focusing on. If you're focusing on, thinking about how the universe is structured, you're going to come up with something. Not now, not tomorrow, not in a year, maybe 10 years, maybe 20 years. But the whole thing is that let's harness that gift and not destroy it. Because I will never go to the beach and build 100 castles of sand. I will never do that. And I'm sure that most of you, they won't do that too. But that child, he did it. He did it because that's his pleasure. He is interested in that. And out of those all autistics, small proportion of them, not many, they are really focused on things that benefits humanity somehow. Like, again, I don't know why I keep talking about Elon Musk, because Elon Musk really has the worst type of autism. And this is a guy of like almost $1 trillion, net worth. It's just amazing. And I'm sure that so many Elon Musks are on the world, in India and everywhere, that have been overrun by society and their, family, being labeled as, oh, he's so retarded. Look at that. He's building, sand castles all over the world. What good is it going to do to him? Just embrace that. When your child show you that I built like 100 castles of sand, go there and say, wow, I'm proud of you. Try that. It works. And thank you for the question. Again, it's really a good question. The second question is, what role does environmental structuring play in transforming ADHD traits into assets? Absolutely, it plays an enormous, role. Uh, you could turn it into an asset only when you harness the goodness and try to monitor the bad part of it, because as I told you, the ADHD people, they love to venture. They love to experience, experiment in new things, which is good when it comes to somebody who's sitting in a lab trying to discover, what enzyme that really could cure cancer, because these people, they really will get it, or they would might get it, I would say. But it is different than when he's on the street trying to experiment different drugs, and see what does it do to him or her, and then he will get into the trap of addiction as such. So environmental structuring plays a very important role, and I wouldn't say here that only it's the parent plus school plus society. Don't call these people crazy, please don't. Please don't. This is an asset. You have to embrace it and thank God for it, because I mean the spectrum God has created, every single part of that spectrum. There are people there, and each one of them, they have a role. Each one of them have a role. Don't think ever that nobody doesn't have a role. You have a role. I do have a role. And ADHD has a role too. Don't destroy it. Take care of the negative things that could really fall into the ADHD children, and let them be kind of, harness that goodness that and the gift that they have, because this gift is enormous, enormous energy, enormous creativity, enormous resilience. How many people they really, I mean, the ADHD, I have friends even ADHD who got, they wouldn't even get tired of doing, let's say, many people, they got divorced and they never married again. Not the ADHD person, not the ADHD. Actually, the ADHD of my friends, some of them are, they are the most loved by their wife because they are fun to be with. They are really fun. And thank you for the question again. Uh, can executive function variability in ADHD enhance creativity and divergent thinking? Absolutely, yes. Yes, it does. It does. Executive functioning, but bear in mind that the executive functioning is driven by attention. So whenever this kind of, this is a probe, and I am here like ADHD, and I have a probe here, and I keep kind of, probing around, and whatever I am kind of probing or focusing on, uh, then my executive function will play a role in it. I'm hoping that I'm not probing into drugs, I'm not probing into women like something else bad. I'm probing into something that I will be guided by family and society and school, that I'm probing into something good. So the executive function variability, it does actually enhance creativity and divergent thinking. And the answer is yes, absolutely. And thank you for the question. It was a good question too.
So, thank you so much, sir, for addressing each questions with such clarity and depth. And I hope our delegates have also received a clear and satisfactory answers to their questions. So, these were some of the questions which we received from our delegates. And once again, thank you so much for your precious time, sir. On the outset, I would like to thank each one of you for joining us today. So, here, with your permission, we will be concluding the session. Till then, stay safe, and I would love to host you again, sir. Thank you.
You take care. Have a good day,
You
guys.
too, sir. Thank you so much.
Bye bye.
Bye.